Thank you very much, Ed. So let's get up here. Okay, so yes, as I said, we're going to be covering treating for worms and the preventative management that we would say is ideal. So as we go through, we will talk a little bit about resistance. I know it's been talked about already, but it's very important. We'll talk about the types of wormers that we have got. We'll talk about which wormer to use and when, because resistance has caused a bit of an issue, so we have to be a bit selective about which wormers we use and when we use them. And then we're going to talk about how to correctly dose, which sounds like a really silly thing to say, but there are some pitfalls. And then also how you can manage your horse to reduce reinfection. So what is resistance? Resistance is the ability of worms in a population to survive treatment with a product that generally would be effective against that species. So it comes about following a genetic mutation in a particular worm. Resistance is passed down from parent worms to larvae. So once the resistance is there, it typically doesn't disappear. This is why we are so concerned. So for the third, fourth, maybe fifth time, there are no new wormers being researched at the moment. So the situation in the UK is that certain species of worms are resistant to certain drugs, which other species may be susceptible to. This is why we choose different wormers depending on test results. So how do we combat resistance? What can we do about it? On a basic level, we treat at the right time and use the correct product for the parasite species that you are targeting. Testing is absolutely paramount, as you probably have gathered already. So we should use testing to guide your treatment wherever possible. If you're treating a worm that is susceptible to more than one drug, it's helpful to alternate between these drugs to reduce exposure to one particular product. And then dose correctly and be fussy about your pasture management. I know some people are very good at being fussy, so be fussy about your pasture management. We will cover most of the topics on this slide in slides to follow, but I just wanted to draw your attention to this word here, which is refugia. You may hear that's talking about it, and I thought maybe just useful to explain the principle behind it. So refugia is the population of parasites that are not exposed to a drug at the time of treatment. They may be worms that are not exposed because they are encysted at the time of treatment, like with redworm, or they may not be inside the horse at the time of treatment, i.e. on the pasture. So these worms remain susceptible to the wormers because they've not been exposed to the drug. This is why we have a cutoff value for fecal worm egg counts, like Emily explained. So we advise you not to treat your horse if they have few eggs, but not too many. This cutoff is a relatively low risk number for your horse. It has been considered, and it means that while there is still the same number of resistant worms, they're diluted by a greater population of susceptible worms, and so the chance of two resistant worms meeting and breeding is reduced. So treating at the right time. Basically, if you're following a testing protocol, you should be treating for the parasites that are likely to be a concern for your horse at the right time of year. Redworms typically emerge around the time of the first frost each year, and so it's advisable to test and treat, if necessary, for redworms in November or December, as Emily said. Tapeworm treatment is recommended up to twice a year in the spring and the autumn. The autumn treatment can tie in with redworm treatment if testing indicates. And then other species of worms are generally a concern during the grazing season. So treatment, again, only if necessary, should be from spring onwards through the summer months. Okay, so what can we treat with? These are things that you've probably seen us give out, or maybe in some saddlers. Tapeworms are susceptible to praziquantel and pyrentel. Pyrentel is the single active ingredient in Strongid P, and if you're using this, we recommend that you double dose this to have the desired effect. So for instance, your horse weighs 450 kilos, dose for a 900 kilo dose. Praziquantel comes in combination products only, such as Equest Pramox, that's the blue box there. And in an ideal world, we only use this if you're targeting both tapeworm and encysted redworm. Encysted redworm is susceptible to moxidectin, and in theory, although there is spreading resistance, a 5-day course of fenbendazole is also a licensed product. So this means that moxidectin is the best drug that we have against a worm that can cause serious illness and fatality in some cases. For this reason, it is absolutely vital that we only use it when we absolutely have to, i.e. test results suggest that it is the best option. We are trying to move away from a blanket dosing treatment with Equespramox sort of towards the end of the autumn, winter time. So if we continue to use moxidectin as a first-line treatment, resistance will quickly spread and then we will have a real problem. Other worm species on the other side are largely susceptible to all wormers except for praziquantel. So this means if you dose for tapeworm with pyrantel or for redworm, you're likely treating for other worm species at the same time. And like Natasha said, this is why large strongyles are getting less common. If you used ivermectin last time, for instance, consider rotating between fenbendazole and pyrantel. That just means that the exposure to all of these drugs is varied. And then finally, bots, like Natasha said, usually an incidental finding, but they are highly susceptible to ivermectin. So these will be eradicated if and when your horse is treated for other intestinal parasites. Pinworms, Natasha mentioned them briefly. They can be really frustrating to treat as eggs survive in the environment for up to a month and makes reinfestation following treatment quite possible. The recommended treatment for pinworms is either pyrantel at a double dose as for tapeworm or fenbendazole. So at the time of treating, clean around your horse's anus with warm water and then all of the surrounding coat to give quite a good wide margin with some mild soap. After this, you can apply a thin layer of Vaseline to prevent any newly layered eggs from cementing to the area. So repeat this every other day for a couple of weeks. In an ideal world, empty the stable, steam clean it, or treat it with an animal-friendly disinfectant as well. Another option is that you can move your horse to a new stable for a month to allow for any eggs in the environment to die off. It's also advisable to disinfect brushes, fencing, anything your horse may have come into contact with, just to try and prevent that reinfection occurring. So my glamorous assistant here is going to demonstrate how to dose for the correct weight. So making sure a horse is not underdosed is really simple, and it's an easy way of reducing the risk of increasing resistance, and it's very important. So if a wormer is not used at a high enough dose, it may not kill all the worms that your horse has, but it will expose them all to the drug. So using weight tape at the very least to dose your horse needs to be stood square and possibly with an extra pair of hands, pass the weight tape around your horse. So the weight tape should sit flat against the body from just behind the lowest point of the withers and then to just behind the elbow. So if you view it from the side like this, it's at a slight angle along the horse. Each weight tape is slightly different, so just make sure you know where to read off. It sounds silly, but you know, there's sort of arrows and loops and things that can throw you off. And as a general rule, take the weight tape weight and add 50 kilos to the weight. Overdosing by 50 kilos is not going to affect your horse, but it will guarantee that you hopefully have an effective treatment. Arguably, it's easier said than done, but make sure your horse doesn't spit out the wormer once he or she has been treated. I know that's quite difficult sometimes, but it's worth giving it a go. So then on to pasture management. Really, good pasture management is the key to keeping worm numbers low and therefore reduce the need for treatment more often. So the fewer worms on the pasture, the fewer worms in your horse, and the fewer chance meetings for romance to blossom and lots of baby worms to appear. So pre-picking should be done at least twice a week to remove feces and therefore eggs from the pasture before they have time to hatch. And then in an ideal world, the muck heap should be a reasonable distance from any grazing paddocks, as worms can be small, but they can definitely travel. Rotating fields allows for natural reduction in worms in the pasture as they die off. It can take a little while. So it's not the best method of reducing numbers, but it can help. In extreme heat, roughly 40 degrees or so, some worm larvae die off in a few days. However, it can take 6 to 9 months of cold weather to have the same effect. So unless you've got a lot of fields, rotating fields isn't going to be your number one go-to. So in a similar vein, harrowing the field can help if done at the correct time. Harrowing spreads the manure and exposes a greater number of parasites to the environment and therefore warmer temperatures. So if it's done at the height of summer, these parasites could die off in a matter of days to weeks. But if you harrow in the winter, it's still going to take that 6 to 9 months for them to go. If you happen to be somewhere where you can rotate species grazing on the pasture, rotating between horses, sheep and cattle help, because each species is affected by different parasites, but they will all ingest the parasites. So this reduces the incidence of disease seen and therefore reduces the pressure to treat. Goes without saying, the fewer horses on the pasture, the less droppings, the easier to manage and the reduced potential for parasite exposure. So that's the optimising stocking density. The fewer horses on the pasture, the better luck you're going to have being able to manage the fields and therefore your worm burden. So finally, in answer to the question that came up for Emily there, new arrivals to a group should ideally be tested before they move or wormed and kept separate for a week whilst any parasites are excreted. So testing and treating for the worms that are present is ideal. If that's not possible, worming before they move and then keeping them, worming them before they move is ideal. So if you'd like to test your horse instead of just treating, ask your vet what they think would be appropriate for your horse and the group that they're about to join. And you can use any of the tests that Emily talked about there. So then this reduces the introduction of potentially heavy worm burdens from a new horse to a hopefully well-managed group. And then once the horse arrives, in an ideal world, keep it separate for a week or so while all of those worms are excreted. And then, yeah, hopefully keep the pastures nice and clean. So take-home messages here. Testing is absolutely vital to preserve our worm efficacy. And it is, like Emily said, for the greater good. It means that it's kind of, we're thinking about the long term rather than just the short term. Treat only if testing indicates it's necessary, and carefully consider your pasture management, which helps to reduce the need to treat for gastrointestinal parasites. If you've got any questions, if you get any results you're not sure about, or if you're generally unsure, just ask your vet. We will always advise you, because obviously it's not simple. There are lots of drugs out there, and it's difficult to pick which one you need for which worm at the right time of year necessarily. And there's my co-pilot. Does anyone have any questions?
Thank you very much, Sarah. That was a very nice, succinct talk. Very good, thank you. I do have a few questions. I mean, someone's asked a question, how effective is poo picking and how often should that be done?
I mean, it is very effective. If you remove the droppings from the pasture, there is less chance that those eggs are going to hatch, and therefore you're going to have less worms on the pasture. We say ideally do it twice a week. If you have the time or the inclination, every day is the most ideal.
And then moving on from that, but as sort of following off with a similar sort of vein, in terms of pasture management, somebody's asked about, they've got sheep on their paddocks, which obviously is a very good way of managing the pasture. Are there any crossover worms we need to worry about between sheep and horses?
Again, that is a good question. No, I don't think. I'm dredging up my farm knowledge. I'm pretty sure that sheep and horses don't share worms. Natasha, would you agree? Yeah, sheep and horses don't share worms.
And so moving in this vein, somebody's asked, before people treated with chemical wormers, what other measures did people use to treat worms, and would they be effective in the future when we really have got mega problems with resistance and we haven't got any new wormers coming along?
So I have heard a client once mentioned to me that he lets his horses naturally worm by eating acorns, and I most definitely wouldn't advise that one. I suppose I'm not sure. We've always had wormers, as far as I'm concerned. Natasha,
I think we're particularly lucky in that we are vets in an era where we do have parasite treatment, because unfortunately I do see firsthand diseases that these parasites can cause, and they can be pretty nasty and horrible, and generally pretty expensive as well. There are ones that were available 20 or 30 years ago which aren't available at all now, because the resistance means that they're not useful for us. And I just mentioned about sheep, but sheep have in the farming industry there's huge problems with resistance to wormers, and they lose a lot of stock potentially to these problems. So I think there was horses were less intensively kept, and we were picking or managing in a better way, so that maybe we didn't have those problems. But I think the problems were there. We had those diseases around. And as I mentioned about the large roundworms, we now don't really see problems from those because of the fact that we have managed to treat these effectively, but they did used to cause a lot of issues. So what did we do for wormers? I'm not sure. Maybe they died. So I think we're lucky in the view of wormers, which is why we're so keen to try and preserve them.
So basically, it's a combination of all these measures, using the wormers, but using them in a targeted way, and then making use of your paddock management and all of the other management tools that we have in our armory to try and reduce the risk of the resistance developing too quickly. Has anyone got any experience of using supplements or herbal remedies, natural wormers, anything like that to treat intestinal parasites?
I personally don't. I wouldn't necessarily advise it. We know that the wormers that we have do work when we use them correctly, and they are readily available. So I think it's possibly not as advisable to use something that with not very much evidence behind it.
And then one final question, which is about pinworms. I had a child's pony that I had terrible trouble getting rid of pinworms. And the only time we ever really saw the pinworms was when we went to a show, and she got excited and she pooed everywhere and the pinworms came out, which was rather embarrassing when the local vet couldn't keep pinworms under control in his own pony. Have you got any experience of using any of our chemical wormers per rectum, using them actually rectally?
So the female worms, the female pinworms actually, so they migrate to the anus when they are laying the eggs. They don't live in the rectum, they live further in. So if you put a wormer up your horse's bum, it's probably just going unfortunately, it probably isn't going to treat the pinworms. It will just be an expense for you, and it will come out the same way it went in a short space of time.
Okay. Well, I think we've been gone long enough there. We've had an hour and a half of equine parasiting. It's been a very informative evening. We will post YouTube clips of these talks on our YouTube channel, and we'll notify people through Facebook when those have been